Good afternoon, everyone, and thank you for joining us for these series of sessions on a broader theme, which is reshaping healthcare with fintech for the emerging middle class. Broadly, what we want to look at is as the health sector looks increasingly to technology to deliver service innovations, the challenges and success of the fintech space, from be it tracking, performance, AI or analytics, all of these will be key to the future of health tech too. We want to look at and see if the benefits and innovation that the financial services sector has got for the people can be extended to the healthcare sector. And to discuss some of these broad trends, I'm joined by Seemant Jauhari, managing partner at HealthXCapital. They're a VC firm that largely sticks only to the space. Seemant, thank you for joining us and being a part of the session. I would like you to take a minute and introduce yourself and HealthX before we move on to the discussions.
Thank you, Joji. Thanks for having me on the panel. It's a pleasure being here. My name is Seemant Jauhari. I'm the managing partner at HealthXCapital, one of the few healthcare dedicated VC funds which invest in early stage healthcare companies in this region, Southeast Asia and India. Prior to this, I was the CEO of research and innovations at Apollo Hospitals back in India, essentially looking after everything from clinical trials, scouting for innovations, commercializing them, and then investing in such startups. Having seen the journey from that point, we have created HealthXCapital almost 3 years back to address what is a disproportionate gap in the ecosystem in terms of needs versus resources and what's an undercapitalized region. And that's where HealthX is trying to create a micro ecosystem with strategic partners wherein we can get smart, connected capital and help startups through their journey from being an early stage startup to, let's say, going to a growth stage startup and flourish from this region for the world.
Thanks, Sumit. Just to kick off the discussions, I'm just when it comes to health tech, just taking off from the introduction where you left off. So, in one of your earlier interactions with us, in your own words, you'd said the pandemic had sort of added fuel to the fire in terms of investments in the health tech sector has gone up. But what has really changed across Southeast Asia, be it Southeast Asia, across South Asia, be it Southeast Asia and India?
I think there's one word for it. The most impact has come on the mindset. I think mindset was the biggest challenge for digital health in this region. And that mindset has been jolted by the pandemic coming in, where you had stuff like telemedicine, which was there for about 15, 20 years, but on the fringes, from fringes to maybe, let's say, adoption rates of 5, 7%. The pandemic forced people to be cornered in a space where they have no other option but to go for a safer option, which is a more efficient option, and adopt such technologies. And that was just one example, right? But essentially, the mindset had to change in the circumstances, and that's what really changed in Southeast Asia, globally rather. What was in process, for example, models like online pharmacies to virtual consults, all of these models were somewhere in different sort of stages of maturity in different markets. But what's happened is they have been accelerated and expedited. And that's also another change that we've seen. And it differs from market to market. For example, India was a little bit ahead in that journey because of the adoption for other tech companies going very speedily. But this just pushed health tech a little more with priority, and it's expedited a lot of that. The other thing that happened, which made an overall mindset change and adoption of such technologies happen is also the regulator, the regulators' own sort of change in terms of adopting or regulating such spaces, which was okay. Normally, a regulator would play catch up to what a innovator would bring in as a new process or a new technology. But here, the regulator was also forced to actually catch up more speedily, be more progressive, allow such things to come in, make what were draft bills into proper bills produced in the parliament, almost next to maybe passing as a law. Um, these things have come to the forefront to be considered more seriously from the regulators' mindset also. And then finally, I think what's really also changed is um, there was obviously caution because of the pandemic, caution in terms of investing, but that caution was not so much with the liquidity or the capital quantum. The caution came about in terms of the stage of funding. So, what was a good trend in increasing sort of funding in early and late stage shifted from, let's say, early more towards late stage. And hence, what we saw was the average deal size actually increased, but usually a lot of the funding sort of shifted from early to later stage. Early stage, which was kind of undercapitalized, became more undercapitalized. So I think that was general sense of changes what were brought about by the pandemic.
Interesting. Just one or two points from what you mentioned, especially that some of these health tech technologies have been around for a long time. If you look at the funding boom that has happened in South Asia, both the markets that you're in, which is Southeast Asia and India, a lot of companies have scaled. We have like 50 plus unicorns across both these regions. There are so many companies that are valued at over 10 billion. But when it comes to health tech companies and entrepreneurs, why haven't they scaled as much with the startup boom? Why is it that the health tech sector, which should have been booming at the time of a major health crisis, still hemmed in by challenges of building large businesses?
Very good question, Joji. I, as a healthcare supporter, always wonder why that is the case. But I think the reality lies somewhere in um, there is a systemic inertia within healthcare, given its dependence on multiple variables. Now, these are you need the clinicians to adopt, you need the patients to change behavior, you need hospitals to fall in line and see profitability, you need the provider or insurance to fall in line. So it's almost akin to saying that you need all these ducks lined up before a particular healthcare innovation, which in the form of a startup would actually make its way from the platform of acceptance to the benefit to consumer, and it has to make sure that all these ducks are lined up, and that takes time. And I think what's really happened, like I said, is um, some things which were on the fringes have become more in the spotlight. Some things which were in in between their journey to become an evolved and a much more adopted technology slash business model has been expedited. But if you say, can I not have scale akin to what we have seen as the technology startups in this region? I think there is a relative boom within healthcare. If you see, there's a relative boom. It's been expedited. But if you compare it to other technology scale outs, the number of dependencies and these ducks to line up is much more. So that systemic inertia makes it slower. But what you see now, what has happened is the seeds have been sown. And what we need to, the next 3 to 5 years are very crucial for Southeast Asia and India for such digital health startups to actually flower and scale out.
Got it. So when we look into the future, considering like you said, many of these health tech areas, which is, let's say, telemedicine or online pharmacy or electronic health, they have been around for a long time. So um, when it when we look about increased adoption, is it the role, or do you see startups in the health tech space playing a big role here, or is it the incumbents and the established players who will have to sort of change their business models and be digital first? How do you see the road ahead?
Mm. Um, I think clearly startups have a primary role to play. I mean, I'll just zoom out and say innovations have a critical role to induce change and transformation in any industry. And startups have a big role to sort of bring that innovation, right? Um, so while startups show the way in terms of laying out a proof of concept, both commercially and let's say clinically, um, they show that this is feasible and realistic in terms of not just a POC, but scaling is also possible. There is monetization at the end of it. And that essentially starts putting the incumbent slash traditional providers in a bit of a corner where they are pushed into changing themselves. As a result of which, you see people, entities such as Apollo hospitals in India, now coming up with something called Apollo 24/7, which is like a completely integrated digital interface, which is like a virtual hospital, um, which will now is a mainstay of of the whole group, which it hasn't done in 37 years of its existence. And that's the kind of impact. You look at Parkway out here, they've got $100 million fund, internal fund, where they have actually where they're investing in technology which can front end engage with patients, patient engagement systems, care navigation systems, AI chatbots. You've got AI analytics for better imaging, more productive systems, better accuracies. All of that is being pushed in with the fact that, listen, I have no other option but to compete with what the startups are showing. Now, having said that, I think at some point in time, both have to coexist together. While the startups can show the way initially, they need to scale. And it's a journey. Ultimately, a patient needs at some point in time to also come to the hospital if necessary. And therefore, they have to be collaborators. And the startups need hospitals for scale and for complicated cases. And basically having the care continuum, whereas the hospitals would need the startups to actually continue the care continuum, to make sure that a patient actually gets an end-to-end care which is more efficient and effective.
Got it. So a lot of what you spoke about is like, in terms of when you mentioned examples like Apollo or Parkway, is all about going digital, which is also what many of the startups are trying to do. What I mean by digital is like virtual with very little human interface. So if that is the way forward for health tech, how do we sort of, and this is a sector that's so used to a human touch, having people around, having physicians sort of consulting doctors and everything. How do you sort of how does health tech and digital go together?
Well, this is a very debated question usually, but I'm pretty clear in my mind in how this is going to evolve. I think when people say that it's healthcare is going to be replaced to a very large extent with digital health, I don't think we're going to get rid of doctors or the caretakers, right? But there'll be pockets and there'll be functions, some extents of which will be replaced or augmented, and a better word is complemented by digital health, AI, and all of those digital health related sort of technologies and innovations. Now, the fundamental point here to be understood is we, healthcare, is dealing with lives. And when it comes to lives, we never leave it to automated analytics and machines and so on. I'll give you a very simple example. We have been flying for ages, right? we've got the finest computer systems on board a flight, but you need a pilot to still ferry because there are lives in it. And what does the pilot do currently? The pilot actually checks all the systems right now, and the systems actually give him the results, and he just needs to have oversight whether the systems are actually telling him what he knows by his own knowledge. And that's a comparison of sorts, and he says, well, these are all check boxes done, and then he's okay. So what the system essentially did is eased it out for him efficiently, effectively, hopefully. All he's doing is in another eye, because there's a huge responsibility to carry with all those passengers. And that's exactly the analogy with healthcare. So if I'm going to have AI analytics to read radiology images to find out better sort of effective radiology reads without a radiologist, probably, but at the end of it, a radiologist will have to see it once to find out whether everything is in check. Usually you would actually have, this would increase the throughput, which means you can do more scans, and the accuracies will be probably also very high, considering that the algorithms can be trained to become very, very accurate, and they have become, right? But at some point in time, there'll be a hybrid of both, settled in, with an equilibrium between the doctor's role being diminished, but complemented to a large extent also by AI, digital health, and so on and so forth. So for a good example is a hospital, a surgery is taking place, invasive surgery. The invasive surgery would need the surgeon, but he'll have AR, VR, the goggles helping him visualize that whole thing better, seeing where he's actually going in, making the surgery more effective. And then post-surgery, the post-op care can be done when he's shifted out into home, let's say, put devices which are connected, throwing out real-time information to the hospital, and the doctor's actually looking for predictive, some kind of reads which show them something might go wrong, and then you can fix it early in time. And that's where really digital health is taking healthcare. But this needs a care continuum to be in place, which also means multiple players to fall in line and some amount of consolidation with different stakeholders talking to each other.
I just want to shift gears a bit in terms of, as an investor, want to ask you, what are the major trends that you're seeing in the health tech space, especially when it comes to integration of fintech, insurtech, and would love to have some examples from you across both regions, be it Southeast Asia and India.
So do you want to generally talk about the key trend?
Yes.
I think what I'm seeing, especially in this region, is, well, a lot of this region is about disproportionate gap between what is needed in healthcare and what is available in terms of resource and infrastructure. And that organically cannot be removed. We know technology has to disrupt. So technology innovation has to be there, which is where what we really need is making a doctor equivalent to 10 doctors by using technology, making a nurse equivalent to 10 nurses, or let's say somebody who's remotely located but does not have access to a good doctor can also do so with virtual consults or with just point of care devices, which can actually give good readings of certain specific clinical parameters, which are required by a doctor sitting far away to know exactly how to diagnose that patient, right? So essentially, what I'm seeing is we will actually see a lot of these scale out aggregator models or marketplace models, which are basically innovation in business models to drive efficiencies in the system. And with these efficiencies, we will not only be able to increase access, but in some cases also affordability. Now, those scale outs are very possible, and we are witnessing that in this region. You take examples of HelloDoc in Indonesia, Doctor Anywhere here in Singapore, and so on, Farm Easy there in India. You've seen the scale outs happen, and this is dependent a lot on the adoption of smartphones and access to internet, and the whole new generation in Asia coming up, basically having access to all of this. And if you can put healthcare to some extent, the access piece of it, on such platforms, then you are bound to have these kind of scale outs much better in this region. That way, this, let's say, lack of access piece gets sorted for, and it's a virtual reach out to a whole lot of needy patients. So that's one. So the scale, the aggregator models, the marketplace models, all of those business model innovations will scale in this region nicely, and that's a huge opportunity. The second one is, in fact, the contrary, data-driven businesses, which are very important. As you know, data has become so much more important because we in this side of the world, barring the Singapores, the Japans, and the developed Asia, a large part of data was on paper. Some part of data was captured, but quality was kind of compromised. And though there where we have got good mining, data which you can actually mine, that's less, but we are going towards it, right? With the EMR systems being in place, blah, blah, blah. But the thing is, Asia has a lot of data, and if you're able to capture it, we can do wonders with it. Now, data-driven companies, AI-driven companies, IP-related startups, these 2-3 categories are something that I see will have challenges to grow in this region in the immediate future. So what we will probably see is these guys picking their bag and baggages and going to the US, finding a more immediate and a larger market in terms of adoption, right? Because it's about market maturity and the correlation of market maturity to what you are producing as an intellectual property. And that's where I see the likes of Bioformuses, Holmusks, and a whole bunch of others. You've got, a list that I know of who are gearing to go to the US, where either they're dealing with predictive analytics or they're dealing with chronic disease management platforms, addressing migraine issues, mental health, remote monitoring. All of these guys will end up in the US, find a good market. Maybe they'll continue operations here, but this becomes a secondary market in the immediate future. Once they get credibility in the US markets and good stability financially, in terms of both capital raises as well as revenues and performance, then they will sort of come back and take a U-turn and start scaling out here. So those are two different types of businesses going differently. A third one, which is very important, is I think a lot of startups here in the first category, which is more the business model innovations, etc. Each one is peddling his own ware, and that's not enough. Healthcare is all about patient-centric healthcare. And if it's not patient-centric, what you're doling out is one piece here and one piece there. So somebody can say that I'm doing virtual consults and the other guy says I deliver medicines home, but actually you need both, right? And so the need of the hour, and a lot of people have understood this, is you need some amount of consolidation or some amount or more amount of collaboration. Either it's a business partnership or it's a entity consolidation. That is another thing that's begun to start happening in terms of business partnerships. It's not become as aggressive as consolidating in mergers and acquisitions, but that will come. So maybe 3 to 5 years, it starts off with business partnerships, goes towards consolidations at the end. And I think the early stage was undercapitalized in this region. It has become more undercapitalized because the risk has made investors sort of look towards the later stage. That said, what it's also done is brought the bigger investors to go earlier as well, to sort of conquer the whole stage continuum, if I may. So you've got the likes of Sequoia doing Sequoia Search. You've got Axel just doing a pre-seed fund yesterday. You've got Axel Atoms. You've got a whole bunch which is going earlier and earlier also. But they're big guys, and they'll be across the stage continuum. so that they find the good ones early. And lastly, in terms of fintech, and you mentioned fintech, and I think there is a fusion in terms of making innovative models where healthcare becomes more affordable and accessible. And I think those models are young, nascent. It will take time to shift. I'll give you some examples. We had a company called HealthFin in India, which was looking at essentially low cost and zero interest credit line for health financing for patients. And essentially, they will then grow into almost like a NBFC kind of format, essentially giving patients who are low risk in terms of paying capability. They give a HealthFin kind of a startup can give them almost a payment upfront for their procedures, and then they sort of charge the hospital for it. So they kind of bring down the fear and the paying immediately for the patients, and the patients can keep paying them back later. The other thing is, I think in terms of customized and specialized insurance plans, you've got a whole list of companies playing in that. Example, health metrics, and from broking to TPAs to managing general agents. The insurance industry is setting up for disruption, and multiple players. A lot of them are playing at the provider side and at the consumer side, where they're trying to onboard on their apps and then try and put them on a chronic disease management platform, or taking them to their insurance in a seamless fashion, reducing the amount of claims, making central procurement of pharmacies, which currently, let's say, for example, in Singapore, at a 300% margin sold in clinics. So if you do central procurement, goes down. So those kind of models are coming down by offering a digital health platform, which takes you to a more funneled panel of doctors who would probably not prescribe at all, or may prescribe, but prescribe low and more relevant drugs. Or if they do so, then they can actually get access to drugs which are centrally procured, at 50% margins as compared to 300% margins, which the clinics charge here. And this is something that my doc was doing, by the way. I have a good word for Snehal, who's trying to get more affordability. And then there are companies like Mia Health, Smarter Health, which are actually going for smarter, faster TPAs, reduction in claims, and more profitable sort of products in insurance itself, which are either dynamically priced, incentivized, incentivized behavioral change in consumers, and so on and so forth, so that the overall product is profitable for insurance. But then it also pushes the consumer to be healthier, and therefore making healthcare also more affordable in the whole run. So there's a whole scheme of sort of fintech and making healthcare more affordable, the whole list of startups which are coming out in that.
Yeah. Thank you for explaining the trends. We're almost running out of time. I can just take one question, which is maybe one audience question too. One more big picture question from my side, which is like, for a long time, when it comes to health tech, we've been hearing the likes of Walmart, Amazon, Google, Apple, all of them sort of being on the forefront of reshaping health tech. And for this region, can it be the likes of, let's say, the Grabs, the Gojeks, the C Group, or even in India, for example, the Flipkarts? Like, all of them have healthcare divisions. They have many of them have telemedicine arms. Some of them are operating in the online pharma space. They're all doing fintech. They're all doing insurance. So do you see many of these companies actually going on to become full-fledged players in the health tech space?
Not in the immediate future. There is a big gap in the mindsets at both ends. The providers and incumbents feel that they can take on the technology, but they're not capable. And the technology guys need the data and the patient ownership, which they don't have, and the hospitals do. And there is not a meeting of minds in terms of sharing the benefits equitably, which is where it'll be a challenge. But eventually they'll have to realize that neither of them can actually do this on their own. Small example, the big techs would probably not understand sharing revenues if they were able to monetize data, and the hospitals would probably not sort of think or recognize the importance of actually having the data miners and the data companies to be able to make interoperability so important. So it's I own versus you own kind of a debate right now. It will take some, at least in this region, 5 to 10 years to get there. The more developed Asia will probably go for it in the next 5 years. The less developed will probably go 5 to 10 years.
Seemant, I just want to take one audience question before we let you go, and that's on the mental health startups in South Asia. Over the last 18 months, has it, when it comes to these companies, in terms of their growth, in terms of the funding raise, is it in line with what you expected, or is it sort of much lower? And how does it sort of compare to the overall funding in the health tech space?
See, mental health is a direct correlation to the market maturity also. Mental health has certain connotations with it, geography to geography. If in the West, in the US, I think it's taken with much more maturity, and therefore they have traveled their journey also. It started much earlier as well. And they have been able to get that data, mine that data, and make it more useful to the consumer, right? And therefore, they are in a much mature state in the US as come for mental health. Arguably, we are still going through the pains and motions of accepting mental health as something. It's okay, it's okay to have mental health issue, and then we go to the next stage, which is the treatment and the management of mental health, which has now been spurred on and pushed in the right direction by, let's say, the pandemic, etc., which has triggered more, so let's say, stress, mental health issues, etc., etc. Plus, there's a big part, the silver economy part, right? The 60% of the world's population is here, and 1/4 of that is greater than 60 years. But having lifespan increase doesn't mean increase in healthy life. It means that we're not, a lot of them will have mental health issues, and we need to be ready to deal with it. I think that realization is just about to come in. It's not there. It's very, very young out here. There is scope, but it will happen in a 5 to 10 year sort of time period, or getting in companies from the West to deploy and scale out here. But it's a journey to be had.
Got it. Yeah, we run out of time. Thank you, Seemant, for joining us for the opening session. Great insights, good listening into you. And we just move on to our first panel. Asking my colleague Michelle to take over and introduce the first set of panelists. Do stay on. Thank you.
Thank you.